There, Rob Shanks from injuryfitpro.com, and this one is for all you new mums and mums to be out there. So in today's video, I'm going to be covering back pain during pregnancy, and I'm going to be covering three common reasons why you ladies could be getting back pain during and shortly after pregnancy, and what you might want to do to help yourselves about that. So the first common reason is that due to the extra weight you'll be carrying, you're probably going to be putting extra load and extra strain through the muscles in the lower back. So that's the sort of thing that could respond well to a deep massage. Obviously, if you are going to have a massage, you probably don't want to lie on your front. So one option will be to lie on your side. The other thing, if you're doing it at home, get your partner to give you a massage with you sitting and you're resting your hands on your elbows, perhaps leaning onto a table. Get them to do some slow, deep massage strokes in the lower back. Maybe some heat in the lower back as well would help to increase that blood flow and reduce that muscular fatigue. Now, the next reason would potentially be facet joint pain. Now, when you're pregnant and the tummy is expanding, that tends to tilt the pelvis forward, which tends to put an increased arch in the lower back. And then these little knuckle-sized joints at the left and right of the spine, so a pair of joints at each level of the spine, they can become under extra load. Normally those facet joints only take about 20% of body weight, but in that situation, and obviously due to the extra weight you're carrying, they're probably going to be carrying extra load, and they can become under strain. So therefore the remedy you want to think about is involving some almost posterior pelvic tilts to try and open up that curve a bit more, assuming you can do so with your tummy, allowing you to do that. The next reason is SACRO-ILIAC joint pain. Now, so the SACRO-ILIAC joints are these joints in the pelvis. So there's one on the right, there's one on the left. And what tends to happen is that towards the end of the pregnancy, under the influence of a hormone called relaxin, the normally quite strong supporting ligaments of those joints become looser. And when that happens, the joints can become under extra strain and may even get to a point where they become misaligned or subluxed. In that situation, you're going to experience probably quite a sharp stabbing pain in around that joint, particularly as you put the weight through onto that leg, and it may even transfer down the leg a little bit, and it may even come through to the front of referred pain to the front of the hip area. Now that pain can kind of sometimes mimic the pain you get from sciatica, so the sort of thing where one of the nerves in the lower back gets trapped. Now, potential little test you can do to differentiate that between that is what we call the straight leg raise test and the bilateral straight leg raise test. So that essentially involves lying on your back, raising one leg up in the air, and as you're doing that, obviously you're actually going to be putting some twists through the SACRO-ILIAC joint on that side. You're also going to be stretching the sciatic nerve at that level, so that might increase the pain in both situations. But then if you then raise the other leg up to meet it, best to get this done by somebody else lifting legs for you. If when you raise that second leg, if that reduces the pain, the chances are, it's an indication, not absolutely certain, but it's an indication that you might be dealing with SACRO-ILIAC joint pain as opposed to a trapped nerve or nerve root pain or traditional sciatica in the lower back. Because under that situation, we might expect that as you raise the two legs and the second leg comes up to meet the first, that would increase the amount of neural tension in the lower back, but it's going to reduce the amount of sacral torsion. So that might be one little useful test you want to think about. If you're quite confident that yes, it's SACRO-ILIAC joint pain that you're getting, and you haven't got pins and needles or numbness or any weakness in the leg, which might coincide with a trapped nerve, then something you might want to consider is a maternity SACRO-ILIAC joint support belt. And essentially what that is an elasticated belt, a bit like this one, that goes round those joints, supports the top of that pelvis, and it's combined with a little sling underneath the tummy which helps to just lift the tummy up a little bit, and involves some straps over the thorax usually which lift the tummy and again helps to take the pressure off the lower back and the pelvis. Again, I'll put some links in the bottom of the description box. If after pregnancy, you probably don't obviously need to have the maternity version, but just the standard SACRO-ILIAC support belt for the first few months after pregnancy can also help to give some support to those recovering ligaments in the pelvis. And this is one such belt here. I've got here one of these makes that I like is called Serola. Again, I'll put some links in, and that essentially is an elasticated belt that goes around that pelvis. And the nice thing about the Serola belts is that you have these extra kind of stirrups which you can then tighten or loosen depending on your preference during the day, and even from one time or another, if you're sitting or standing, you can tighten or loosen that. And I found those to be pretty helpful with my clients. Now, obviously, the other thing that you want to be considering is that because of the extra stretch that the abdominal wall has during pregnancy, that's going to stretch those core muscles, those toe muscles in the lower back, in the tummy, in the core. So that's the reason why pregnant ladies are advised to get on with some core strengthening and some Pilates style exercises after they've given birth to really try and tighten up those core muscles, so they're less likely to develop other types of back pain later down the line, such as disc strains and other ligament and joint problems in the lower back. So that's good advice as well. Okay, so that pretty much concludes today's video. I hope you found it useful. If you did, please share it with anybody you know that it might be useful for. In the meantime, please consider subscribing to the channel. I've got lots more content coming up this year, not just on back pain, but on all sorts of issues and injury prevention tips and safe exercise tips. If you do want more information on back pain though, not just pregnancy back pain, but all types of back pain and some of the options that you may not have heard of, they're covered in my new book, Back Pain Decoded, which is available on Amazon. In the meantime, if you've got any comments, please put those in the sections below, and I'll do my best to address those in future videos.